President, I'd ask unanimous consent to take up Senate File 406 with Senator Hogue and then Senate File 297 with Senator Dotzler.
Senator Gronstal calls up Senate File 406 with Senator Hogue and Senate File 297 with Senator Dotzler. The chair recognizes the senator from Lynn, Senator Hogue, for opening remarks on Senate File 406.
Thank you, Madam President. Colleagues in the Senate, Senate File 406 is a bill that addresses our mental health commitment process that came through the Judiciary Committee. Its origins were with the Judicial Task Force of the Department of Human Services. A task force made a series of recommendations, and this legislation largely reflects those recommendations. So here are a couple things you need to know about commitments. First of all, we have a significant increase in the numbers of commitments each year. Last year we were over nearly 9,000 commitments for adults. We're over 1,500 commitments for juveniles. It is rapidly growing. If you remember, the Chief Justice talked about that in his Condition of the Judiciary speech. There are problems with the current commitment process. One of the problems is in the area of the advocates who are appointed to work with the people who are committed. They are currently hired by counties, which provides a lot of inconsistency in the qualifications, training, and compensation for the advocates. It also creates a lot of inefficiency. I had the chance to visit with some advocates who say they spend far too much time driving around the state to attend to the people to whom they've been assigned. So, for example, if you get committed from Lynn County, you might get put into a facility in Woodbury County. And then that advocate has to drive all the way from Lynn County to Woodbury County to fulfill his or her job. And so this has the potential, this bill, by bringing the commitment process into the Division of Human Rights, or the Department of Human Rights, excuse me, has the ability to streamline that process, provide consistency, and improve the efficiency. So that is Divisions 1 and 2 of the bill, deals with that. Division 3 is a little more technical in nature, which is to eliminate a Chapter 222, which is a commitment process for people with intellectual disabilities. The workforce said that that's not used, and if somebody does need to be committed and would otherwise qualify for commitment who happens to have an intellectual disability, that person can be committed through Chapter 125 or Chapter 229. That is Division 3 of the bill. Division 4 of the bill streamlines the application process so that there's a single application form for people under Chapter 125 who have a substance abuse problem, and Chapter 229, which is a mental health condition that creates a risk to the public. Division 4 also provides for a pre-application screening process for all applications pursuant to Chapters 125 and 229. It makes it available. This was something our committee heard about that is effective in saving taxpayer dollars as well as improving services for the individuals. And finally, and this is very important, it directs the Department of Human Services to do a study regarding the development of a hospital bed tracking system for commitments. Right now, each entity, each hospital that has somebody who needs to be committed spends the time calling around to facilities around the state. As one administrator described to me, in concentric circles away from the hospital, and so there's a lot of staff time used in trying to find a bed for a person who's been committed. What the study will do is come up with a proposal for a single point of entry for commitment so that somebody is tracking bed availability before the bed is needed. And so there'll be one place that hospitals can go to find a bed for the person who needs to be committed. Madam President, that's my description of the bill. If there are any questions, I'd be happy to try to address them. If not, I would simply move the bill.
Is there further discussion on Senate File 406? Seeing none, the senator from Lynn moves that Senate File 406 be read the last time and placed on its passage. All those in favor of the motion say aye. Those opposed say no. The motion prevails. The secretary will read.
Senate File 406 by Committee on Judiciary, a bill for enacting relating to involuntary commitments for persons with substance-related disorders, mental illness, and intellectual disabilities, and providing for the creation of an Office of Mental Health Advocate in the Department of Human Rights, including effective date provisions.
The senator from Lynn moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Those opposed say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of Senate File 406 will vote aye. Those opposed vote no. The secretary will receive your vote. Senator Sorensen votes aye. Senator Bowman votes aye. Senator Kornbach votes aye. Senator Kapuchian votes aye. Senator Zumba votes aye. The chair recognizes Senator Chalgren.
Thank you, Madam President. Would you please excuse Senator Zahn until he returns?
Senator Zahn will be excused. Chair recognizes Senator Chalgren.
Can you please excuse Senator Anderson until he returns?
Senator Anderson will be excused. Has every senator voted? Every senator has voted. The secretary will close the voting system. The secretary will lock the voting system and record your vote. The Senate will pay attention to the result of the roll call vote. Those voting aye, 48. Those voting nay, 0. The bill, having received a constitutional majority, has declared to have passed the Senate, and the title was agreed to. The chair now recognizes the senator from Black Hawk, Senator Dotzler, for opening remarks on Senate File 297.
Thank you, Madam President. Ladies and gentlemen of the Senate, Senate File 297 is a bill that deals with miscellaneous policy changes in the Economic Development Authority. Some of the first actions refer to a change with the EB-5 grants that are out there, investor program. This is what's called the EB-5 is an immigrant investor program administered by the United States Citizenship and Immigration Services Department of Homeland Security, and it really deals with grants that go to purchase businesses and to make new commercial ventures, and it requires a 40% increase and 10 full jobs. Typically, these programs contracts are put together for a longer period of time than what current law allows for. Current law has a 2-year restriction on it, and the department wanted to lift that restriction, and we agreed with that. Also, it has some other provisions in there to deal with the elimination of the micro enterprise development grants. They were actually never really funded, so and there's not been really a lot of interest in that, so we eliminate that. Also, they eliminate the Broadband Access Joint Governance Board and this has been replaced with a Connect Iowa Advisory Board, which does similar duties, so they're removing that language. And then also it removes the language requiring the Iowa Economic Development Authority or the authority to get this out. I will get this out. It requires the authority to currently to sign off on local property tax agreements that are made on commercial projects, and really the authority believes that they ought to not have to sign off. They figure that that's the deal between the cities and the counties, and whatever they agree to, they should be allowed to do. Now, Madam Chairman, there are amendments, but we have to withdraw some and do some things, so I'd just soon go to that right now.
We do, Senator Dotzler. The First Amendment is Senate Amendment 3059 with Senator Dotzler. Senator Dotzler, you are in order for opening remarks on Senate Amendment 3059.
Okay, this amendment really kind of conforms to the House file, and once one of these sections is a little bit different, and I have a second amendment that will actually settle the two differences between. So I'm just going to move this amendment, and if there are no questions with that outstanding explanation, I'll just move the amendment.
Is there further discussion on Senate Amendment 3059? Seeing none, the chair recognizes Senator Dotzler for closing remarks. Senator Dotzler moves that Senate Amendment 3059 be adopted. All those in favor say aye. Opposed say no. The motion prevails. The amendment is adopted. Senator Dotzler. With the adoption of Senate Amendment 3059, Senate Amendment 3055 is out of order. The chair recognizes Senator Dotzler.
We have the Senate file conforming to the House file. I would like this substitute, Senate file 297, for House file 397.
Senator Dotzler asks for unanimous consent to substitute Senate File 297 with House File 397. Are there objections? Hearing none, so ordered. Senator Dotzler, I believe you have another amendment now to House File 397.
Yes, I do, and this
you
is...
do. Senate Amendment 3060 is called up. The chair recognizes the senator from Blackhawk for opening remarks.
Okay, now that everything is running smooth as possible, we have this amendment before us, and this is really the kind of a disagreement that we had with the House, because along with the EB-5 extension of time that we agreed to, there was another provision in the bill that said all contracts with the Department of Economic Development, those could be lifted also, the time period in which they could make that. And we had concerns in the Senate that if the Department or the Economic Development Authority decided to make a long-term contract, for example, in marketing, that could go for 5 to 10 years, and with a change of administration, we need to really make sure that we do that on a shorter period of time. We believe this will be an agreed-to provision with the House as kind of a compromise, and we agreed to limit the other contracts through the Economic Development Authority to 3 years. So that's what this amendment does. So we'd have a lift on the time period for the EB-5s to three years, and then all other agreements would be 3 years. So with that, thank you, Madam President. If there are no questions, I just move the amendment. Hope I can sit down.
Is there further discussion on Senate Amendment 3060? Seeing none, The senator from Blackhawk moves that Senate Amendment 3060 to House File 397 be adopted. All those in favor say aye. Those opposed say no. The motion prevails. The amendment is adopted. We are now back on House File 397 as amended. Is there further discussion? Seeing none, the chair recognizes the senator from Blackhawk, Senator Dotzler, for closing remarks on House File 397 as amended.
Thank you, Madam President. This is a good bill, and I suggest that we move for the last time placed on its passage.
The senator from Blackhawk moves that House File 397 as amended be read the last time and placed on its passage. All those in favor of the motion say aye. Those opposed say no. The motion prevails. The secretary will read.
House File 397 by Committee on Economic Growth, a bill for enact relating to the administration of duties and programs by the Economic Development Authority.
The senator from Blackhawk moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Those opposed say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of House File 397 as amended will vote aye. Those opposed vote no. The secretary will receive your vote. Senator Kornbach votes aye. Senator Kapuchian votes aye. Senator Zumbop votes aye. Senator Bertrand votes aye. Has every senator voted? Every senator has voted. The secretary will close the voting system. The secretary will lock the voting system and record your vote. The Senate will pay attention to the result of the roll call vote. Those voting aye, 48. Those voting no, 0. The House file having received a constitutional majority is declared to have passed the Senate, and the title was agreed to. Senator Dotzler, I believe we need to withdraw.
Yes, we do.
Chair recognizes the senator from Blackhawk, Senator Dotzler.
I'd like to withdraw the Senate file, 297.
The senator from Blackhawk asks for unanimous consent to withdraw Senate File 297. Are there objections? Hearing none, so ordered. The chair recognizes the senator from Potawatomi, Senator Gronstal.
Thank you, Madam President. Madam President, I'd ask unanimous consent to immediately message the House Senate File 406 and House File 397.
The senator from Potawatomi asks for unanimous consent to immediately message Senate File 406 and House File 397 to the House. Are there objections? Hearing none, so ordered. The chair recognizes the senator from Potawatomi.
Thank you, Madam President. I would now like to go to Senate File 427 with Senator Danielson.
The chair recognizes the senator from Blackhawk, Senator Danielson, for opening remarks on Senate File 427.
Thank you, Madam President. Madam President, colleagues of the Senate, Senate File 427 is an improvement to the existing statewide plumbing and mechanical licensing code. The bill before us attempts to do 4 things. 1, cut red tape and streamline the licenses that are required under the law. It also reduces the burden of multiple dates and deadlines. We propose a uniform calendar for renewals. Third, we reduce paperwork by streamlining the process for reporting, hopefully taking advantage of information technology and working with both Workforce Development and the Iowa Department of Public Health to achieve that. And then finally, we think it'll make job bidding easier because we apply a more uniform code statewide. So 4 benefits of the bill, and I'd be happy to answer questions if there are any.
Senator, I believe there are some amendments to the bill. Senator Danielson, you are in order for opening remarks on Senate Amendment 3032.
Thank you, Madam President. Madam President, colleagues of the Senate, Amendment 3032 is purely technical. It cleans up grammar in the bill where we had failed to underline the date 2015.
Senator Danielson, would you please come to the well? Is there further discussion on Senate Amendment 3032? Seeing none, the chair returns to Senator Danielson for closing remarks.
Thank you, Madam President. Madam President, Amendment 3032 is actually addressed in the follow-on Amendment 3053. I would request to withdraw Amendment 3032.
The senator from Black Hawk asks for unanimous consent to withdraw 3032. Are there any objections? Hearing none, so ordered. Senator Danielson, you are in order for opening remarks on Senate Amendment 3053.
Thank you, Madam President. Madam President, colleagues of the Senate, Amendment 3053 addresses a concern that our local communities had about both the adoption of a statewide code as well as the implementation dates. The amendment allows the board by rule to make changes as the follow-on codes are updated by their national boards, and it also says to the local communities, cities above 15,000, who many of whom have already adopted similar codes, are able to do that. There's no enforcement requirement, and makes it very clear that cities that have not previously had to adopt, generally those that are under 15,000, as a result of this law, can continue not to adopt the statewide code. So we believe it's taken care of those concerns that were initially addressed in the bill. I would be happy to answer any questions if there are any.
Is there further discussion on Senate Amendment 3053? Seeing none, the chair recognizes the senator from Black Hawk for closing remarks on Amendment 3053. The senator from Black Hawk moves that Senate Amendment 3053 to Senate File 427 be adopted. Those in favor of the motion say aye. Aye. Opposed say no. The motion prevails. The amendment is adopted. We are now back on Senate File 427 as amended. Is there further discussion? There is further discussion. The chair recognizes the senator from Dallas, Senator Chapman.
Thank you, Madam President, and thank you, Senator Danielson, for the being able to work with you on this bill. I think this is a good bill. It's going to help streamline the mechanic code, the plumbing code. I think it provides some stability throughout the state, so there's reasonable expectations. And I'm just happy to have been able to be a part of working on this bill, and would ask my colleagues to support the bill. Thank you.
Is there any further discussion? Seeing none, the chair recognizes the senator from Black Hawk, Senator Danielson, for closing remarks on Senate File 427 as amended.
Thank you, Madam President. Madam President, colleagues of the Senate, I'd like to thank Senator Chapman for his help on this bill. As we know, licensing bills are not always easy to solve, but We have an agreement between all the stakeholders around the state. We believe this will cut red tape, improve productivity, and help folks save money in the long run. I would anticipate some changes in the House, so we're likely to see this come back again, and we'll look at those changes as they do come back. With that, Madam President, I move Senate File 427 as amended be read for the last time and placed on its passage.
The senator from Blackhawk moves that Senate File 427 as amended be read the last time and placed on its passage. All those in favor of the motion say aye. Opposed, say no. The motion prevails. The Secretary will read.
Senate File 427 by Committee on State Government, a bill for an act relating to the licensing of plumbing, mechanical, HVAC, refrigeration, sheet metal, or hydronic professionals, including transition provisions, including effective date provisions, and making penalties applicable.
The senator from Blackhawk moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Opposed, say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall Senate File 427 as amended be approved? All those in favor of its passage, please vote aye. Opposed, vote no. The Secretary will receive your vote. Senator Zumba votes aye. Senator Johnson votes aye. Senator Kornbach votes aye. Senator Chelgren votes aye. Has every senator voted? Every senator has voted. The Secretary will close the voting system. The Secretary will lock the voting system and record your vote. The Senate will pay attention to the result of the roll call vote. Those voting aye 48, those voting no 0. The bill, having received a constitutional majority, is declared to have passed the Senate, and the title was agreed to. The chair now recognizes the senator from Pottawatomie.
Thank you, Madam President. Madam President, I'd ask unanimous consent to immediately message the House Senate File 427.
The senator from Pottawatomie asks for unanimous consent to immediately message Senate File 427 to the House. Are there objections? Hearing none, so ordered. The chair recognizes the senator from Pottawatomie.
Thank you, Madam President. Madam President, Appropriations Committee will meet immediately in room 22. I'd move that the Senate stand in recess until the fall of the gavel. We'll come right back out as soon as they're done and get back to the debate calendar.
The senator from Pottawatomie moves that the Senate stand in recess for an Appropriations Committee meeting. All those in favor say aye. Those opposed say no. The motion prevails. The Senate is in recess.
Senate will be in order. The chair recognizes the Senator from Potawatomi, Senator Gronstal.
Thank you, Mr. President. Mr. President, I now ask to go to the individual confirmation calendar and the names of David Loy, Wayne Engel, John Marino, and Patricia Weiss with Senator Danielson.
The chair recognizes Senator Danielson.
Thank you, Mr. President. I think you have to call them up individually.
We will first call up for David Loy to the Accountancy Examining Board. You're in order.
Thank you, Mr. President. Mr. President, colleagues of the Senate, I have done our due diligence on Mr. Loy. I found him to be qualified in all respects. If there are any questions on the nominee, I'd be happy to answer them.
Are there any questions on the nominee? Seeing none, the Senator from Blackhawk, Senator Danielson, moves the appointment of David Loy to be confirmed. The Secretary will open the voting system and receive your votes. Senator Smith votes aye. Senator Beal votes aye. Senator Courtney votes aye. Senator Dotzler votes aye. Senator Taylor votes aye. Senator Kornbach votes aye. Has every senator voted? Every senator has voted. Those voting aye, 49. Those voting no, 0. The nominee, having received a two-thirds majority, is confirmed. The chair recognizes Senator Danielson for the nomination of Wayne Engel for the Electrical Examining Board. Senator Danielson, you are in order.
Thank you, Mr. President. The subcommittee and committee, having done their due diligence, is happy to move the appointment of Wayne Ingalls to the Electrical Examining Board, and I'm sure Senator Mathis will be especially happy about that. I'd be happy to answer any questions if there are any on the nominee.
Are there any questions? Seeing none, the Senator from Blackhawk, Senator Danielson, moves the appointment of Wayne Engel to be confirmed. The Secretary will open the voting system and receive your votes. Senator Kornbach votes aye. Senator Courtney votes aye. Senator Dotzler votes aye. Senator Taylor votes aye. Senator Smith votes aye. Senator Hatch votes aye. Has every senator voted? Every senator has voted. The Secretary will close the voting system. The Secretary will lock the voting system and record your votes. The Senate will pay attention to the result of the roll call. Those voting aye, 49. Those voting no, 0. The bill having received constitutional two-thirds majority is now confirmed. The chair goes to Senator Danielson for John Marino, Electrical Examining Board.
Thank you, Mr. President. Mr. President, colleagues of the Senate, the subcommittee and committee, having done their due diligence, would be happy to move the appointment of John Marino as a member of the Electrical Examining Board and ask that he be confirmed by the Senate if there are no questions.
Are there any questions? The chair sees none. The senator from Blackhawk, Senator Danielson, moves. John Marino moves the appointment of John Marino to be confirmed. The secretary will open the voting system and receive your votes. Senator Smith votes aye. Senator Dotzler votes aye. Senator Quirmbach votes aye. Senator Shelgren votes aye. Senator Brace votes aye. Senator Courtney votes aye. Senator Taylor votes aye. Senator Whitford votes aye. Senator Hogue votes aye. Has every senator voted? Every senator has voted. The secretary will close the voting system. The secretary will lock the voting system, record the votes. Those voting aye, 49. Those voting nay, 0. The nominees having received two-thirds majority is confirmed. The chair goes back to Senator Danielson for the nomination of Patricia Weiss, Electrical Examining Board. You are now in order.
Thank you, Mr. President. Mr. President, colleagues of the Senate, the subcommittee and committee, having done their due diligence, moves the appointment of Patricia Weiss as a member of the Electrical Examining Board and asks that the Senate confirm if there are no questions.
Are there any questions? The chair seeing none. And the senator from Blackhawk, Senator Danielson, moves the appointment of Patricia Weiss to be confirmed. The secretary will open the voting system and receive your votes. Senator Sorensen votes aye. Senator Whitford votes aye. Senator Courtney votes aye. Senator Taylor votes aye. Senator Brace votes aye. Senator Dotzler votes aye. And Senator Quirmbach votes aye. Senator Smith votes aye. Senator Ernst votes aye. Has every senator voted? Every senator has voted. The Secretary will close the voting system. The Secretary will lock the voting system and record your votes. Those voting aye, 49. Those voting no, 0. The nominee having received a two-thirds majority is confirmed. The chair now recognizes the Senator for Potawatomi, Senator Gronstal.
Thank you, Mr. President. Mr. President, I'd now ask unanimous consent. Actually, I don't need unanimous consent. They're all eligible. I would call up Senate File 393 with Senator Bolcom, Senate File 391 with Senator Dotzler, and Senate File 358 with Senator Hogue.
Senator from Potawatomi, Senator Gronstal, calls up Senate File 393, Senator Bolcom, Senate File 391, Senator Dotzler, Senate File 358 with Senator Hogue. So ordered. The chair recognizes Senator from Johnson, Senator Bolcom for Senate File 393. Opening remarks.
Thank you, Mr. President. Mr. President, ladies and gentlemen of the Senate, Senate File 393 is a bill that essentially addresses the need to better detect congenital heart defects in newborns. Congenital heart defects account for 24% of infant deaths due to birth defects. This bill requires that every newborn in Iowa shall receive a pulse oximetry screening to determine whether or not there is any need for concern. The test is simple, painless, non-invasive, and cost-effective. Mr. President, that's the bill. There is an amendment.
Senator, there is an amendment. This would be S 3057 by yourself. You are in order.
Thank you, Mr. President. Mr. President, ladies and gentlemen of the Senate, Senate Amendment 3057 is a simple one. It makes a couple changes to the bill. The bill encourages reporting of test results to the Department of Public Health. The amendment would basically say the reporting would not be required unless there was available funding to manage that. The other thing that the amendment does, the bill calls for a task force to give some recommendations on prenatal care. We've decided to strike the task force. Mr. President, that's the amendment. I'd be happy to answer questions.
Are there any questions on S 3057? Seeing none, Senator Bolcom moves the Senate Amendment S 3057 be adopted. Those in favor say aye. Those opposed say no. The motion prevails. We have another amendment, but with the adoption of S 3057, that puts S 3014 out of order by Johnson. We are back on the bill. Is there any discussion on the bill? Seeing none, the chair goes back to Senator Bolcom for closing remarks.
Thank you, Mr. President. Mr. President, ladies and gentlemen of the Senate, this is a really simple bill. It gets to a concern that a lot of parents have to make sure when they bring home their newborn that they're safe to do that. We heard a lot of testimony from moms that had been put through some pretty bad circumstances by bringing their kids home and finding out they have this heart defect, and puts these newborns at substantial risk. So we're pleased to have this bill before us today. I just invite a yes vote and hope that we can get this over the House and get it onto the books. Thank you, Mr. President.
The senator from Johnson moves that Senate File 393 be read for the last time and placed on its passage. Those in favor of the bill, favor of the motion, vote aye. Those opposed say no. The motion prevails. The secretary will read.
Senate File 393 by Committee on Human Resources, a bill for an act relating to prenatal care, including required congenital heart disease screening for newborns as part of the state's newborn screening panel.
Senator from Johnson moves the reading thus far be considered the last reading of the bill. Those in favor of the motion vote aye. Those opposed say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of Senate File 393 will vote aye. Those opposed will vote no. The secretary will receive your votes. Senator Bowman votes aye. Senator Sorensen votes aye. Senator Peterson votes aye. Senator Shelgren votes aye. Senator Quirmbach votes aye. Senator Courtney votes aye. Senator Brace votes aye. Senator Taylor votes aye. Senator Hatch votes aye. Senator Smith votes aye. Has every senator voted? Every senator has voted. The Secretary will close the voting system. The Secretary will lock the voting system and record your votes. The Senate will pay attention to the results of the roll call. Those voting aye, 49. Those voting no, 0. The bill having received the constitutional majority is declared to have passed the Senate, and the title was agreed to. The senator from Blackhawk, Senator Dotzler. Chair moves the senator from Blackhawk, Senator Dotzler, for Senate File 391. You are in order.
Thank you, Mr. President. Ladies and gentlemen of the Senate, Senate File 391 comes to us basically from a request of the Majority Leader and the Speaker of the House. Last year, there was a Supreme Court case that was held, Neal versus Annette, over an individual who was hurt on the job and normally was away from home from part of the week, but coming home every weekend. And his employer requested and required that that individual take temporary light duty within the prescribed restrictions that he could do because of the injury. The problem was that light duty was placing him away from home, and he would not be able to return every weekend or during the week, which he was used to doing. And because of that, this court case came forward because that individual was denied his work comp benefits. It went through the appeal process through the commissioner's office. The commissioner ruled that it would be he should be entitled to his worker compensation benefits, and it went all the way to the Iowa Supreme Court. The decision came back down, basically stating what was considered reasonable, appropriate work for an individual, and because of that, there were some questions that were left unanswered. And our leaders requested the Iowa Workers' Compensation Advisory Committee to take this issue up. Towards the end of the session last year, a House member assembled a group of claimants and attorneys to try to define what is classified as suitable work, and they were unable to reach an agreement. And so in the letter to the Iowa Workers' Compensation Advisory Committee, Speaker Paulson and Leader Gronstal, in a signed joint letter, laid out some parameters in which they asked the Compensation Board to take a look at and work through these. One, defining what suitable work would be, what is light duty and given to that, making sure that the individual is informed of what the light duty is, and if he declines, what are those, and why the work that when that individual refuses to do it, why that is not acceptable by the employee. They have to say why they think about it. And then also dealing with the definition of suitable work in regards to geography, where it will be versus where you live. And because of that, the Work Comp Commission worked over the interim and came up with this bill. And this bill is a recommendation from the Work Comp Advisory Commission. And in it, they go on to define what is suitable work. They also talk about the various things that was asked upon by our leaders in both chambers and answered that about what suitable work is. They got language in there that specifically states the employer has to put in writing what kind of work it is and how it fits in within the parameters of that individual's restriction, and also requires that the employee explain why they are refusing this work and for what reason. So the bill really lays that case out, and that is basically the general explanation of this bill, Mr. President.
I believe there are amendments to this bill. The chair will recognize the senator from Dallas, Senator Chapman, for Senate Amendment 3039. You are in order.
Thank you, Mr. President. Mr. President, I would ask to withdraw Senate File 3039 as we have another amendment that clarifies.
So moved. Senate Amendment 3039 will be withdrawn. We have another Senate Amendment 3045 with yourself. Senator Chapman, you're in order.
Thank you, Mr. President. Senator Dotzler, I appreciate the work of the Advisory Council, Workers' Compensation. The committee was asked to tailor a very narrow response to an Iowa Supreme Court decision, as you mentioned. The Supreme Court case involved a driver for one of Iowa's prominent motor carriers who refused suitable work offered by the company. The solutions offered, and which is in your bill, is much wider in scope and frankly misses the mark. This amendment gives the body of this legislature the opportunity to vote on legislation that narrows the scope of the bill and addresses the concerns of traveling employees. The first portion of my amendment addresses an issue that businesses face, and that is an employee's willful violation of work safety policies. This could be something from texting on the phone that would cause a accident. That person could be charged criminally. As we know, texting is illegal in this state as we're driving, but yet workers' compensation would still have to be granted to that employee. So the first section addresses that particular issue. The rest of the amendment addresses the traveling employee and really narrows it down to something that I believe this entire body can support, something that lays out expectations of both the employer and the employee. Thank you, Mr. President. I'm happy to answer any questions.
Are there any questions? Senator from Blackhawk, Senator Dotzler, you're in order.
Thank you, Mr. President. Ladies and gentlemen of the Senate, I find it particularly interesting that Senator Chapman talks about the commission going beyond the scope of what the request was, but yet one of the first things in his amendment broadens the scope, because that wasn't the texting while driving wasn't something that was requested by either chamber. It didn't come out of the commission's the Compensation Advisory Committee's work, and yet you add some new language. Ladies and gentlemen of the Senate, just to help clarify what the Iowa Workers' Compensation Advisory Committee is and what it's about. First of all, it was a committee that was put together to deal with very controversial issues, to take politics out of these issues dealing with workers' compensation. And workers' compensation world has been something that has been very contentious over the years. It was a program that was put together to keep from litigation, that we had scheduled injuries within that, and that workers' compensation document has been something sacred from both the business side and the workers' side of representation. And so I've heard a lot of communication from the other side of the aisle, from my friends over there, talking about bipartisanship, and that how we really got to work together to come up with positive results in this chamber. And that is exactly what this Workers' Compensation Advisory Council is about. It's about bipartisanship. Now, they sent the letter and requested that the Compensation Advisory Committee take up this charge and look at these issues to help clarify what the Supreme Court ruling is about. And they worked on that from when we got out of session all the way through the summer into the fall and came up with this document. Now, when I say they, I want you to realize, members of this chamber, who they are. Now, first of all, you have agency representatives, which represent Iowa Workforce Development. Teresa Waller, the director of Iowa Workforce Development. Chris Godfrey, the Iowa Workers' Compensation Commissioner. Then you have agricultural representatives. You have the Iowa Farm Bureau, who sits on this commission. You've got health services representatives. You've got, for the labor side, you've got the Iowa Federation of Labor. You've got the United Steelworkers. You also have the UAW and iron workers. Now on the opposite side, for management, here's the bipartisanship. You have the Iowa Association of Business and Industry representative. You have Pella Corporation, Deere & Company, H&I Corporation, and Mid-American Energy representing the business. Then you've got Claimants Council, those people that represent individuals with claims. And you have a variety of different attorneys, 5 of them representing it, that are representing the companies. And then you've got defense counsels also. So you have a group of defense counsels, and it don't end there, ladies and gentlemen of the Senate. You also have insurance representatives, people who represent the insurance companies who pay these claims out. And then ex officio members who represent former members who happen to be commissioners appointed by Republican and Democratic governors. Now that's a long list, and I took a little time to go through it because I think it's important that you understand that if there ever was a bipartisan commission and balance, this is it. And guess what? Guess what? Every single member of that advisory council voted for this recommendation. And I want to tell you it wasn't easy. And so, when you look at that number of individuals who spent all this time working on it, and us as senators bring bills up and amendments that say that we know better, that we can decide better than they have, I mean, that just don't cut it. The reason we put this is over into an advisory council, Senator, and I know you're new here, is to avoid the political aspects of worker comp issues, to take the very politics out of it that I heard your side of the aisle address to us. Too bad everything's political. You know, we're bringing up bills just for political reasons. Well, I got news for you. This is a bipartisan, non-political bill that should not be amended. I got parts of this bill, Senator Chapman, that I don't like. In fact, in the bill it says that the employer will put in writing what the job offer is going to be. You know, here's what your work assignment will be. Here's where it will be, and whether it'll fit within the restrictions. And then the employee has an opportunity to respond to that, but they're also told that if that employee says no in that document, that they could actually lose their benefits. So they've got that put in the worker's mind who was hurt that, oh my goodness, if I turn this down, I could lose the benefits entitled to my family. And if that isn't intimidation, I don't know what is. But this was put together by a bipartisan group of individuals, and I'm going to stand by this bill the way they put it out, without an amendment, not because I'm 100% happy with it, because I want to take politics out of the work comp system. And so with all that, Senator Chapman, I'd like to ask you a question. Would you yield? In view of what I said, Senator Chapman, I want to give you an opportunity to withdraw this amendment and let the bill go forward as it should, because we've had a total bipartisan agreement between labor and business, between attorneys representing both sides, and from the insurance industry. Every single person, not one dissenting vote on the bill that's before us today. Now, because of all that, I'm going to ask if you would please withdraw that amendment.
No.
Well, that's disheartening, because this bill needs to be bipartisan from the commission and from this chamber. That's the way it works. Mr. President, I move to defer.
Senator from Blackhawk moves to defer the bill. We will defer on this bill. The chair will now recognize the senator from Lynn for Senate File 358. Senator Hogue, you are in order.
Thank you, Mr. President. I was so caught up there in the exciting debate over the last bill that I kind of forgot to get ready for this bill, but here we go. Senate File 358 is the bill I know you've all been waiting for. It addresses title to real estate. What the bill does is basically two things. First of all, we're trying to clean up some old contracts for the sale of real estate. And what happens right now under the law is that it presumes that if you have an old real estate contract that does not reflect performance of that contract, that it's presumed that the buyer, the person buying the property, has abandoned that contract. What this bill does is it changes the way that's handled to be clear that the buyer provides relief for the buyer if the buyer actually did perform the contract. The basic lesson here is that people should record their real estate transactions. And if you've got a real estate contract, that's good, and if you complete buying that transaction, you should try to get that done. But what sometimes happens is the contract vendor doesn't always provide the deed. And so this bill is trying to clean up that section. The second thing it does is it gives the buyer a ability to demand that the deed be provided, and if they institute that proceeding and in 45 days nobody says it hasn't done and they meet the other criteria, then it's deemed that they have performed the contract. So this is a bill to kind of clean up some title issues for very old real estate contracts. It's a little bit pro-buyer versus being pro-seller. Mr. President, there is an amendment.
There is an amendment. The chair recognizes Senator from Lynn, Senator Hogue, to take up Senate Amendment 3061. You're in order.
This amendment, 3061, is technical, trying to correct the future repeal of a couple of the subsections that are dealt as transition provisions. And if there are no questions, I would just move Amendment 3061.
Are there any questions? Seeing none, the senator from Lynn moves that Senate Amendment 3061 be adopted. Those in favor say aye. Those opposed say no. The motion prevails. We are now back on Senate File 358. Are there any questions on the bill? Seeing none, the chair goes back to Senator from Lynn, Senator Hogue.
Thank you, Mr. President, and I would just move Senate File 358.
The senator from Lynn moves that Senate File 358 be read for the last time and placed on its passage. Those in favor of the motion say aye. Those opposed say no. The motion prevails. The secretary will read.
Senate File 358 by Committee on Judiciary, a bill for an act concerning title to real estate.
The senator from Lynn moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Those opposed say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of Senate File 358 will vote aye. Those opposed will vote no. The Secretary will receive your votes. Senator Shelgren votes aye. Senator Cornbach votes aye. Has every senator voted? Every senator has voted. The Secretary will close the voting system. The Secretary will lock the voting system and record your votes. The Senate will pay attention to the results of the roll call. Those voting aye, 49. Those voting no, 0. The bill having received the constitutional majority is declared to have passed the Senate, and the title was agreed to. One quick note for those folks up in the gallery. We do not allow flash photography. It's prohibited by Senate rules, so please no flash photography. The chair now recognizes Senator from Potawatomi, Senator Gronstal.
Thank you, Mr. President. Mr. President, I'd ask unanimous consent to immediately message the House Senate File 393 and Senate File 358.
Senator from Potawatomi asks to move Senate File 393 and Senate File 358 to the House. So ordered. Senator from Potawatomi, Senator Gronstal, you're now in order.
Thank you, Mr. President. Mr. President, I would now call up with Senator Peterson, Senate File 416 and Senate File 294.
Senator from Potawatomi, Senator Gronstal calls up Senate File 416 with Senator Peterson and Senate File 294 with Senator Peterson. So ordered. Senator from Chair now calls up Senator from Polk for Senate File 416. Senator Peterson, you're in order.
Thank you, Mr. President. Section 1 of Senate File 416 updates the lease language for counties. It brings the dollar amount governing lease purchase contracts for county general funds in line with the dollar amount for county general obligation bonds. Before 2006, the spending limitations were equal in these two sections. When the legislature modified the limitations on county general bonds, the dollar amount for lease purchase contracts weren't correspondingly updated. Section 2 puts county borrowing in line with city and school borrowing. County projects would be on equal footing with city and school projects by saying referendums are based on the principal amount of bonds instead of the total cost of the project. There is an amendment.
There is an amendment. You are in order for Senate Amendment 3054 by yourself. Senator Peterson.
Thank you, Mr. President. And this amendment comes from me and Senator Schneider. The amendment strikes section 2 of the bill and then reinserts the language. The amendment adds county buildings that house the judicial branch to the definition of essential purpose up until a certain dollar amount based on the population of the county and the percentage of space occupied by the judicial branch. I'd be happy to take any questions.
Are there any questions on Senate Amendment 3054? Seeing none, the chair goes back to Senator Peterson. Senator Peterson moves that Senate Amendment 3054 be adopted. Those in favor say aye. Aye. Those opposed say no. Motion prevails. We are now back on the bill. Senate File 416. Are there any questions? Seeing none, the chair goes back to Senator Peterson for closing.
Please move the bill be read for the last time and placed upon its passage.
Senator from Polk moves that Senate File 416 be read for the last time and placed on its passage. Those in favor of the motion say aye. Those opposed say no. The motion prevails. The Secretary will read.
Senate File 416 by Committee on Judiciary, a bill for relating to authorization procedures for certain county projects involving real property.
The senator from Polk moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Those opposed say no. The motion prevails. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of Senate File 416 shall vote aye. Those opposed vote no. The Secretary will receive your votes. Senator McCoy votes aye. Senator Chapman votes aye. Senator Kornbach votes aye. Senator Whitford votes aye. Senator Dotzler votes aye. Has every senator voted? Every senator has voted. Secretary will close the voting system. Secretary will lock the voting system and record your votes. The Senate will pay attention to the roll call. Those voting aye, 40. Those voting no, 9. The bill having received a constitutional majority is declared to have passed the Senate, and the title was agreed to. The chair now calls up Senate File 294 with the senator from Polk, Senator Peterson.
Thank you, Mr. President. The bulk of this legislation is technical changes, but it does include a section that creates a grandfather transition period for those practicing in the ortho field who do not have a BA as now required by the new licensure law. To apply, a person must be certified by an accredited board, be in good standing with that board, or continuously practice 30 hours per week or more for 5 of the past 7 years in an accredited and bonded facility. And this affects a very small number of people, and they felt that the transition time for this grandfather clause was adequate. If there's no questions, I would simply move the bill.
I believe we have to move or substitute to the House File 166. Is that correct?
Yes, that's correct.
So Senator Peterson asks to substitute to House File 166. Senator Peterson asks to move to House 486. Substitute for House File 486. So ordered. Are there any questions? Seeing none, chair goes back to Senator from Polk, Senator Peterson, for closing remarks on House File 486.
I move the bill be read for the last time and placed upon its passage.
Senator from Polk moves that House File 486 be read for the last time and placed on its passage. Those in favor of the motion say aye. Those opposed say no. The motion prevails. The Secretary will read.
House File 486 by Committee on State Government, a bill for neck relating to persons offering orthotic, prosthetic, and podorthic services to the public and relating to the scope of orthotic, prosthetic, and podorthic services which may be ordered by certain healthcare providers, including transition provisions.
The Senator from Polk moves the reading thus far be considered the last reading of the bill. Those in favor of the motion say aye. Those opposed say no. The motion prevailed. Is the title agreed to? The title is agreed to. The question now is, shall the bill pass? Those in favor of passage of House File 486 shall vote aye. Those opposed shall vote no. The Secretary will receive your votes. Senator Sorensen votes aye. Senator Chapman votes aye. Senator Whitford votes aye. Senator McCoy votes aye. Senator Kornbach votes aye. Senator Dotzler votes aye. Has every senator voted? Every senator has voted. The secretary will close the voting system. The secretary will lock the voting system and record your votes. The Senate will pay attention to the results of the roll call. Those voting aye, 49, no, 0. The bill having received a constitutional majority is declared to have passed the Senate, and the title was agreed to. The chair now recognizes Senator from Polk, Senator Peterson.
Thank you, Mr. President. With the passage of House File 486, I ask that we withdraw Senate File 294.
Senate File 294 is withdrawn. The chair now recognizes the senator for Potawatomi, Senator Gronstal.
Thank you, Mr. President. Mr. President, I would now call up Senate File 296 with Senator Yoakum. Pardon me, let me message those bills first. I'd ask unanimous consent to immediately message the House Senate File 416 and House File 486.
Senator from Potawatomi, Senator Gronstal, moves Senate File 416 and House File 46 be moved to the House. So moved. So ordered. The chair now recognizes Senator from Potawatomi, Senator Gronstal.
Thank you, Mr. President. I now call up Senate File 296 with Senator Yoakum.
Chair recognizes Senator Dix.
Thank you, Mr. President. Mr. President, Republicans will caucus immediately in room 24.
We'll be at ease for a caucus, Republican caucus in room 24.
These are Iowans who care for our kids and our adults with disabilities. These are the Iowans who work at convenience stores and retail shops throughout our entire state. They are the working poor. They work. They just happen to earn a low wage and happen to work for an employer who doesn't offer health care, nor can they afford to buy it on their own. That's who we're talking about tonight. This legislature and this governor will not ignore the opportunity to bring the security of health insurance to tens of thousands of uninsured working Iowans. We agree on that. This legislature and this governor will not take a pass on controlling health care costs. We agree on that. This legislature and this governor will not miss the chance to refocus health care on prevention and wellness, or the chance to pay health care providers for the unpaid care they currently provide. We agree on that. Because today in Iowa, our hospitals face $1 billion in uncompensated care. Research indicates that Iowans pay an additional $1,000 a year in insurance premiums to cover some of the costs of uninsured Iowans. Some have called this a hidden tax. Don't fool yourselves. We are paying for it. Those of us who are fortunate enough to have health insurance. We are not here tonight to debate if the number of Iowans living without access to health care should be reduced. What we are here tonight to do is to decide how to get it done. Senate File 296 has many provisions that the governor's office and the Senate agree on. For example, we agree to focus on wellness and prevention. We agree to move away from fee-for-service. We agree to pay health providers to keep people healthy and change our health care system to a system of wellness rather than a system of sickness. We agree. We agree. Senate File 296 includes the governor's innovation language, the innovation grant language. We, like the governor, believe in an integrated care system, and we agree that moving to outcome-based Medicaid is the way to go. Governor Branstad has repeatedly said he doesn't believe the federal government will keep its financial promise with regard to Medicaid expansion. You know, it's well worth noting that the federal government has never failed to meet that obligation in almost the 50 years that Medicaid has been in existence. But it's also worth noting that Medicaid expansion under the Affordable Care Act has already been budgeted. It has already been allocated to the states. It was enacted during the pay-as-you-go rule. And if that is not enough, ask this question. How, if the governor's is the governor's concern alleviated by asking the federal government to fund 60% of a new, yet-to-be-designed, Healthy Iowa plan? Federal costs exist either way. What's more is that the governor's plan will ask Iowa taxpayers to pay again to the tune of about $162 million annually versus zero under Medicaid expansion. We've already paid for it. Iowans get the biggest bang for their tax dollar by expanding Medicaid. Nevertheless, in order to respond to the governor's concerns, during this debate, we will amend this legislation to include a compromise on this point. Following the lead of other Republican governors, Iowa will be able to reevaluate our participation in the Medicaid expansion if the federal government does not keep its promise. We will be offering an opt-out amendment. So here's a brief summary of the bill before us. It allows working Iowans between the ages of 19 and 64 to enroll in the Medicaid program if their incomes are below 138% of the federal poverty level. That doesn't make much meaning to most people, but this is what it means. It means these are Iowans who, if they are single, are earning $15,800. Or if you are a family of four, you are living on $32,400 a year or less. That's who we're talking about. They aren't people who are trying to game the system. They are our neighbors and friends, and they have a face, and they are the face of the people who are working in our nursing homes and our residential care facilities, and the list goes on and on. The benefit package will be the very same as the current Medicaid program, which I might add keeps administrative costs very low, 3 to 5%. Private insurance, right now anywhere 35 to 40% administrative overhead. Under the Affordable Care Act, even the private sector is going to have to start reducing its administrative costs not to exceed 15%. That is in it as well. Senate File 296 moves all Medicaid-provided services to an integrated care model, a more holistic approach to delivering health care. The focus, again, is on prevention and avoiding expensive future treatments. Supports will be used to remove barriers to health services and to promote healthy choices. And I am all fingers here all of a sudden. The Department of Public Health and the Department of Human Services will develop reimbursement rates that reward providers for helping make Iowans healthier while creating financial incentives that focus on quality outcomes and personal responsibility. In addition, there is also a legislative advisory council that will be created to guide and oversee the creation of that integrated care model for Medicaid. And because building a healthier Iowa and a stronger state economy requires reducing long-term health care costs for everyone, this legislation also creates a legislative commission on integrated care. This commission will make recommendations on accountable care organizations and approaches using value-based financing and emphasizing person-centered, coordinated, and comprehensive care. Members, I believe that the governor's office really wants to sell our state, and it will be done and be much easier and much more enhanced by this legislation, because we know that healthy workers are more productive and cost less to employ. At the end of the day, I believe Iowa will participate in Medicaid expansion. I believe that because I know we are not going to turn our backs on 100,000 uninsured working Iowans. To continue the pointless partisan bickering when we have an opportunity to improve the lives of Iowans is the right thing to do tonight. Stop the partisan bickering. This is not about a Democrat or Republican or an independent. This is about our friends and neighbors who work every day, pay by the rules, and simply are uninsured. With that, Mr. President, I would like to yield the remainder of my opening remarks to the senator from Polk, Senator Hatch.
Senator Hatch, you are in order.
Thank you, Mr. President, and thank you, Senator Yoakum. Colleagues of the Senate, imagine, if you will, in Iowa where everyone will have the ability to go to the doctor whenever they're sick. Imagine where if you ever lost your job, you'd never have to be afraid of losing your health care. Imagine in Iowa where we could put partisan bickering aside and create and continue a dialogue and conversation with each other and our colleagues on how we're going to make Iowa the healthiest state in the nation. Can you imagine it? I can. Because in Iowa, we have a long history of providing bipartisan and cooperative work through the many health care bills we've already passed in the past 5 years, and with mental health the last 2 years. Those were models for us, models that have been published in documents and publications across the country. We can continue that same kind of cooperation. But tonight we have two choices. One of the versions is the choice that we have through Medicaid expansion. It is similar to legislation that's been adopted or will be adopted by a majority of the states in this country, representing a vast majority of Americans. Senator Yoakum has already provided you with the overview of the Senate plan, where patients have responsibilities, doctors have responsibilities, and we embark on a new delivery system, a healthcare delivery system that integrates and coordinates everything from your primary care to your specialty care. My task tonight is to describe the governor's plan and to show you how it is insufficient to meet the demands and expectations of Iowans. Reason number one, it's unaffordable. Low-income working Iowans will choose not to purchase insurance under the governor's plan because it is unaffordable and it's high premiums and high deductibles. Instead, they will be using their limited disposable income to pay for housing, food, gas, or any other expense for their children. In the end, they will get their health care the old-fashioned way. They'll go to the emergency room. And you and I will be paying for that in our premiums in our insurance plans. Reason number 2, it doesn't do much. The governor's plan covers far fewer Iowans than the Senate plan, even if you accept his optimistic expectations and assumptions. Insurance under the governor's plan will even cost more per patient than under the Medicaid plan. Reason number 3, it's inefficient. There is no doubt that insurance under the governor's plan will cost more per patient than Medicaid. The governor is talking about using private contractors to create a new brand that will have in a complex system for invoicing and coordinating. It will take years and millions of dollars under his plan of state tax dollars to duplicate what Medicaid already does. Senator Yoakum talked about the administrative cost. It's the medical loss ratio percentage that she's talking about, that the Affordable Care Act has now required all insurance companies to lower to 15%. But Medicaid charges between 3 and 5% of administrative costs. That level of efficiency cannot be matched by any private insurance plan. Reason 4, the governor's plan limits patient access. We all know a key failure of Iowa Care is that it forces rural Iowans to drive long distances to a limited number of providers. Under the governor's plan, this mistake is repeated. There will be limited and unknown number of providers. It will be a Swiss cheese coverage network. Once again, the quality of the care is not what you need, but it's going to be where you live. Reason number 5, the governor's plan fails to solve the problem of uncompensated care. Emergency room at those hospitals that are out of the network continues to be passed on to the hospitals and then to us on our premiums. Reason 6, there are multi-million-dollar holes in the fiscal assumptions of the governor's plan. The governor's plan scoops $44 million from the county property tax plan to fund the new system. That money is already pledged for our county, for our mental health redesign, a program that we worked on for 2 years, negotiated with supervisors and counties, providers, and worked all summer and all fall with 6 work groups to work on the details on how our mental health system would be expanded. He goes in and scoops that money to use it to pay for his mental health system of his new plan, leaving counties at risk and certainly the services that they provide and we're attempting to provide with that county money in jeopardy. In addition, the governor's plan scoops $42 million from Polk County. The same mechanism they've used to fund Iowa Care, he wants to use a Polk County property tax levy for Broadlawns. And he says that that's acceptable to them, except that you can't take that money unless you guarantee it's going to be repaid. And you can't guarantee that without the volume. And under the governor's proposed plan, that volume is going to be distributed all over the state. So the only way to guarantee Polk County residents that they would not lose any money is through the state general fund. In total, that's $86 million in state total fund dollars, in state general fund money, that he will be using to fund his program. And then reason number 7, the governor's plan is barely a plan. For more than 50 years, Medicaid has provided health care to those in need. The effort to expand Medicaid to the working poor has been going on for years. 9 months ago, the governor said he would prepare an alternative. As of today, we have a 4-page narrative. But it's enough for us to understand that it's ill-conceived and it's unsustainable, and worst of all, it spends $163 million of Iowa general fund money. As you heard from Senator Yoakum, that is an expense that the Senate plan does not absorb. As a matter of fact, the fiscal note came out today of this bill and said that the Senate plan will cost the state of Iowa $169 million over 7 years. That's equivalent of the amount of money the governor's plan will cost in just 1 year of Iowa taxpayers' money. His plan will cost $1,150,000 over 7 years. Now, can anybody tell me why that is a good thing? We are struggling with finding money for property taxes reform, for school aid, for a variety of services on mental health. And yet somehow $163 million times 7 for $1.1 billion of our money is going to go for something that can be funded by the federal government with our help for the next 7 years. Here's the Achilles heel of the governor's plan. It utterly fails to help roughly 100,000 working Iowans receive health care. Why would we leave people out? Here's all the governor's plan really is saying to those Iowans. You find the money, you buy in, and if not, you have to get out. The premiums and deductibles that he requires from working Iowans that are making just enough to stay alive, he's asking that person to contribute. Our responsibility is to make sure that person stays healthy so they can contribute in greater ways. But under the governor's plan, that's not a consideration. The governor's plan fails to help these folks. And they are the very people the Senate plan reaches out and helps. Despite costing the Iowa taxpayer $150 million more than the Senate plan, the governor's plan could still leave as many as 100,000 Iowans uninsured. Tonight, I ask the Senate to respect the dignity and hard work of these Iowans. They aren't the most desperate. The most desperate are already covered under Medicaid. These are Iowans that you pass on the streets, in the grocery stores, in your line of work every day. These are people who are working 2, 3 jobs, low-wage jobs. These are people who we want to help. So in this debate, in this dialogue, let us remember those Iowans and not get caught up in the partisan bickering over ideology. Because as Senator Yoakum laid out, there are a lot of ideas in this bill that the governor has already embraced in his 3.5-page narrative. There are a lot of things in this bill that you have embraced. Let's move this over like we do in the old days. Move it over to the House. Then when we negotiate, if this is a bipartisan vote, my friends, you'll be sitting at the table with us. So let's make this a bipartisan vote today and help Iowans as we move this process through. We have a lot of work to do. This is not the ending of the process. It's just the beginning. Thank you, Mr. President.
There is an amendment. The chair